Thanks for being here. My name is Lauren Williams. I'm Adult and Community Services Manager for the Columbia Public Library, which is part of the Daniel Boone Regional Library System. Welcome to today's Lunch and Learn, where we'll be learning about how funds from the American Rescue Plan Act, or ARPA, are being used in our community. And today's Lunch and Learn is co-hosted by the library and the League of Women Voters of Columbia Boone County. Before I begin, or before we turn things over to our moderator, just a couple of very familiar Zoom housekeeping items. Our presenters will be taking questions via chat. So if you have questions as we're going along, please do find that speech bubble icon at the bottom of your screen, or if you're on a tablet or a phone, you may have to tap in the middle to get those menu items to come up. Just click on that speech bubble and type in your question. We are also recording this presentation, so it will be available in the next day or two on both the League's YouTube channel and the library's YouTube channel for future viewing, or if you want to share with folks that couldn't be here today. So now I'd like to welcome our moderator, League of Women Voters of Columbia Boone County President Barbara Hoppe. Thanks so much, Barbara.
Oh, thank you so much, Lauren, and the Columbia Public Library for co-hosting our Lunch and Learn programs. Really pleased today that we have joining us Boone County Commissioner Janet Thompson and Columbia Boone County Director of Public Health, Stephanie Browning, to share with us about the American Rescue Plan Act and the funds and what the present state is, and have an opportunity to ask questions. Just a little introduction for Janet and Stephanie. Janet Thompson was elected as Boone County District 2 Northern Commissioner in November of 2012 and was sworn in January 1st, 2013, and was reelected November 2016. She grew up in Michigan and moved to Boone County with her family in 1959. She received her bachelor's degree in 1978, her master's degree in Spanish in 1980, her law degree in 1984, and her master's in alternative dispute resolution in 2002, all from the University of Missouri. She served as an assistant public defender for the Missouri State Public Defender System for almost 25 years. And we actually were down the hall from each other for many of those years and did a lot of discussion of city issues and county issues. She was an arbitrator for FINRA, resolving security disputes around the country. She also served as a disciplinary hearing officer for the Missouri Bar. She's published articles in the Fordham University Law Review and the Journal of the Missouri Bar, and given many presentations for the Missouri Bar and other associations. So we're very pleased that Janet has made time to share information with us about ARPA. And I'm also very pleased that today we have with us Stephanie Browning of the Boone County Health Department, the Director of Public Health and Human Services. She's had that position since 1999. I might mention that in 2021, Stephanie Browning and Scott Clary, along with the Boone County Health Department, was given our local league's Outstanding Citizen Award for the outstanding work they did during the height of the COVID pandemic. So thank you for that, Stephanie. She has led the department to become a nationally accredited public health agency, providing comprehensive, evidence-based, diverse program and services. She previously worked for the Yuma County Health Department in Yuma, Arizona. She has a Bachelor's of Science and Health from the University of Central Arkansas. She did graduate studies in public health at the University of Arizona. And the University of North Carolina, Chapel Hill. And she's been actively involved not only locally, but in the state public, and still serves on the Missouri Association of Local Public Health Agencies. And I believe she's had many leadership roles in that organization also. So thank you so much, Janet Thompson and Stephanie Browning, for joining us today. And I'll turn the program over to you.
Thank you, Barb. It is an honor to be on any panel with Stephanie, and to have my former colleague, Barb Hoppy, here is another honor, because it was because of Barbara that I made the decision to run for Boone County Commissioner. So thank you, Barb, for your modeling of public service. It's pretty outstanding. And now Stephanie is my Jiminy Cricket, just like Barb was for many years. So as Stephanie and I were talking about this presentation today, we thought we'd do first a little bit of a look back. You know, it's kind of, the last few years have gone really fast and at the same time really slowly. It's been sort of a tidal wave that we've been caught in the middle of, and it seems to be a tidal wave that continues. So if we look back to March of 2020, that was actually when the federal government passed what was known as the CARES Act. And that was the first time that we had seen federal dollars coming to local jurisdictions to address the COVID-19 pandemic. And, you know, when in retrospect, again, it's everything is different in hindsight. You know, we thought, oh my gosh, we've got all of this money, and here's the guidance. It was 4 pages of rules. 4 pages of rules. We knew very little. We knew that the money had to be allocated not by the very end of December. Apparently in Washington, December 31st was not the end of the year, but we knew we for the year that we had to spend the money. We knew we had to get it out the door, or it would go back to DC. And we also knew that any expenditure had to be COVID-19 related. And that was the essence of those 4 pages of rules. It had to be COVID-19 related expenditure. And so when we were looking at that, we realized we had to be very careful about how we were spending it as a county. Because if we had allocated it in a way that the Treasury Department said decided ultimately was inappropriate, for instance, if we had given it to Barbara and whatever organization she represented, and that was determined to be a misallocation of funding under the CARES Act, Barbara wouldn't have had to pay it back. Her organization wouldn't have had to pay it back. If it was Boone County making that allocation, Boone County would have to pay it back. And so that was something that was always kind of at the back of our minds as we were looking at every application for that funding. So that was something that was really important for us. And as we move forward, one of our major partners in all of the process, quite honestly, was our Columbia Boone County Health Department, because we had the guidance, we had local guidance to help us understand the needs of the community. And as we were looking at those 4 pages of guidance, you know, we knew that there were things like PPE that was needed. We knew that other jurisdictions within our community needed assistance. We knew that hospitals needed assistance. We knew that our health department needed our assistance. We knew that small businesses needed assistance, and residents needed assistance with housing and those kinds of things. But Stephanie was the boots on the ground for CARES Act. And so just to kind of put this in context, we thought it might be helpful for us to do that look back through our eyes, the county's eyes, and also through the health department's eyes. So Stephanie.
Sure. Well, I think that if anybody followed what was happening in 2020 and beyond, I think the one thing that you probably would have came to understand pretty quickly is that the infrastructure that was needed to mount a public health response to a pandemic was lacking. And I don't say that to have any negative connotation against the city, the county, the agencies that have funded us predominantly over the years. It's just, we had always have always and continue to have great support from both. but we had never experienced a pandemic. And so it quickly became very apparent that our existing capacity and resources were not going to be enough to give the kind of response that we felt our community needed and deserved in the midst of a pandemic. And so we did put a request into the commission. In that time, we were having weekly meetings with every school superintendent in Boone County. We were having weekly, if not twice weekly, meetings with all the hospital CEOs and chief medical officers, working with our healthcare community as over the time as vaccinations became available, working with all the vaccinators, trying to coordinate and make sure that we were maximizing every single resource we had in a scarce environment. And so we did, when that funding became available, we did put together a proposal for the commission, and they worked with them to get that funded. And that allowed us through last September to have disease investigation staff that were temporary employees that were handling all of the cases, with our staff sort of leading and coordinating that effort. We had case investigators. We had whole teams of people led by internal and then extra staff that we were able to hire as temps that helped put together business guidance and school guidance and answer all of the many emails, calls, everything that came as a result of all the unknown and what was happening in the community. One of the things we knew that was an issue was the testing capacity in Boone County. Janet had a real, Janet played a really good role in helping us to be able to maximize our testing early on, because she reached out to Gene Trait, who had the ability to do PCR testing through another route when we were being very limited on what we could submit. And so working with all of our partners and through Janet's leadership, we were able to establish that relationship, and Boone County had some of the best early testing out the gate. But they also made it so that if people were needing testing and resources were not available, hospitals could actually submit if they were unfunded through us. And we would get them reimbursed for testing. So there was just a lot going on. As you can imagine, our public safety organizations had a lot of needs, especially for PPE, things like that. And it was really those funds that made that happen. And I think Boone County was just really, really responsive. I have other health departments across the state that to this day have never received a penny of CARES Act funding, and they probably won't receive any ARPA funding from their commissioners. So I think that we should always remember that we have a commission that really does care and have the best interests of the community at heart.
Well, and thank you for that, Stephanie. But, it from my perspective, also, it was interesting to listen to other commissioners across the state who were saying they were sending all of the money back because they didn't want to misspend it and they didn't want to make mistakes or whatever. And so they sent the money back. And I was like, oh, dear Lord, your community needs this. So we were fortunate here in Boone County that we had great partners, and we had a super partner in the entity that is the health department. With that background, however, now we're moving into, when we moved into March, it's funny, CARES Act was passed in March of 2020. In March of 2022, Congress passed ARPA, the American Rescue Plan Act. And that gave us much more extensive guidance. So here's the text of the rule, of the final rule. It's 114 pages. So we went from 4 to 114. And in the process of developing the final rule, which is available on our website, and I think it's available on the city's website as well, if you want to look at the final rule, it went through a lot of iterations. There were tons and tons. You pretty much blinked and there was another interim rule that came out. And lots of FAQs that were being posted by Treasury. One of the really good things that was happening for us locally because the money was coming locally. There's some money that's come down to the state level, but there's a substantial amount of money that's come locally. And there was a person in the room in Treasury from the National Association of Counties that was there representing local jurisdictions. A lady named Erin Hurley was there every single day, making sure that local jurisdictions' needs were being addressed in how each of the interim rules and how the final rule came out. So we've gotten much more extensive guidance on this round of funding. And there are categories of permitted expenditures, and we will go into that a bit. But some of the things that, again, are sort of the guardrails for ARPA that were similar guardrails on the CARES Act has to be COVID-19 related expenditure. And for this funding cycle, everything has to be fully appropriated or obligated by December 31st of 2024, has to be fully expended by December 31st of 2026. And something that when people are thinking about expenditures and how we're going to affect the transformational change that Congress really talked about with ARPA funding, is that this is one-time funding. Yes, it's available to this community until the end of 2026, but what people on both sides of the aisle in Congress kept telling us is, don't set the expectations of your community by something that you're going to create that will then end December 31st of 2026. Because you're setting your community up for a bad result, or not the greatest result, because it is, again, one-time funding. And so with those things in mind, we started off being at least at that point, there were 2 lawyers on the commission. So we said, you know what, we need to make sure that we're working within the guardrails of the legislation. Since it was 114 pages, we wanted to make sure we were there. And so we actually have, we hired an organization, a bond counsel, to make sure that we are staying within those guardrails. And so it's about a $50,000 expenditure that we thought was money well spent, so that whatever we do, we have considered and we are staying within those guardrails for the ARPA legislation, so we don't, as a county, have to pay funding back, because that would be a really bad thing for the county and the residents in Boone County. And I can tell you really quickly some of the stuff that we've already expended. There is a category that allows expenditure for what they call replacing lost public sector revenue. There is a presumption that the lost sector, or the lost public sector revenue, is $10 million. And so we took that presumption, that funding, out of the funding that was allocated to Boone County, and that will be utilized over it will be taken out of that ARPA fund and put in 4 payments into Boone County's revenue, so that we can make some, what we're hoping will be transformational changes in our community over that time. Again, COVID-19 related, but that's it meets that first criteria, one of the criteria under the fund. Other things that we've paid out so far, we had to do some payment back to the sheriff, because one of the problems that we had in 2021 primarily was because of COVID-19 and the impact on our jail. We had to move from double selling people to moving people out of county. And so that cost an inordinate amount of money. And we had to pay that back, and that was a bit over $607,000. So that we had to reimburse that payment.
Hey, Janet,
Yeah.
I want to add a plug here for the sheriff. I have to say, just from a public health director perspective, that during the pandemic, he was truly remarkable to work with, and the steps that and the way that they approached taking care of people within Boone County Sheriff's detention facility was, you ought to be really proud of our sheriff.
Thank you for saying that. You know, when I've talked to other folks in other counties, I think we are very fortunate because he took steps to keep those detainees safe, his detainees and his staff, and, you know, everybody safe. And actually he and his staff and the folks at the courthouse worked together to find ways to keep people's cases moving forward. We did a lot of work during all of that time to say, how can we allow people to talk to their lawyers? You know, how can we make that happen, but in a space that recognizes the public safety issue and the public health issue, right? For those conversations to happen. And so there's been a lot of changes in our system that were thought of by the sheriff, to your point, Stephanie, and then the court said that sounds really good. And so we've now changed processes to make them much better for our detainees in our county jail. So that's been a huge benefit. But again, there was a cost there that we had to reimburse. Other things that we've already paid for, there was some PPE that we ended up paying about a little less than $5,000. We made a payment it was a match payment of funding to the Boone County Nature School of $250,000. And then the Housing Authority came to us and asked about some housing renovation. And the city put $2 million into that project, and the county put $5 million into that project. So those funds are already allocated, which leaves us at about $18,000 or $18 million left to allocate. And so that's what we're looking at now. And Stephanie, I don't know if you want to start talking about your process, and then I'll follow up with our process for allocation of funding.
Oh, could I ask a question?
Sure.
So the total amount of money that you received is around
About
what?
35 million for the county.
And does that include the city?
No, 25.2 for the city.
Yeah.
Okay.
Yeah. And Barb,
Okay.
just, you know, I guess just to put a point on it, $35 million and $25 million sounds like a lot of money, but it so isn't.
So much need.
There's so much need. And some of the things that are directly addressed in the ARPA legislation, you know, one of the things, as I said, was that replacing lost public sector revenue. That's a piece that's highlighted. Another is responding to public health and economic impacts of COVID-19, another big category. Another big category is premium pay for those necessary workers, right? And then the other piece that people don't think of in the context of public health or pandemic, but are so integral to the process, are all the infrastructure, right? It's broadband, because we learned about telehealth during the pandemic.
Homeschooling.
Right, homeschooling, you know, so much work, you know, people figured out that they could work from home and continue to work. So broadband is a particular item that's called out in the ARPA legislation as being eligible for payment. Water and sewer infrastructure, particularly called out, water infrastructure, like just the water pipes, but also stormwater, wastewater, all of those things. Those are particularly called out as eligible expenses within the ARPA legislation. So, a lot of emphasis has gone towards more social service kinds of funding. But there's also these very tangible public infrastructure projects that are specifically called out in the ARPA legislation.
And is there a list someplace of what has been spent so far?
There's a list on our county website as to what's been spent so far, but there's also there's a list of the frequently asked questions on the county website, and I think the same on the city. These frequently asked questions are important to look at because it gives you kind of an idea of how broad the spectrum is about potential ways to spend the money, depending on the needs of your community. There's some communities for which maybe broadband isn't a real issue. For Boone County as a whole, broadband is a huge issue because the inequities in our community are exacerbated by whether somebody doesn't have access to broadband. And those kinds of things. So I'd encourage people to look at the FAQs that Treasury has put out there. National Association of Counties, NACO, has also all of those FAQs out there, and we have the FAQs on the county website, Show Me Boone.
Thanks.
Yep.
So I can talk a little bit about what the city has done. The city council took a little bit different approach than the commission, but the one wonderful thing is that they do talk, and I get to meet with the county commission every month. So we've really been coordination throughout this all. So what the city council did when this funding initially came out, and again, waiting for the guidance was everything, because I think the one thing that we are all, and Janet, you can speak to this too, that we're all very concerned about is if you follow anything that's going on in Washington, D.C., all along we knew that if we spent it incorrectly, then we were going to have to pay it back, which we didn't want that to happen. But now we're hearing more and more conversation about unspent funds, taking that back to reduce deficit, to any number of things. And so we also don't want that to happen, right? So it's a fine dance with making sure you do everything and you're super accountable to it, but yet trying to do it with some degree of speed, again, without falling afoul of any of the rules. And the rules are pretty intense. So what the city council decided is that they wanted to break that funding into two tranches, the first tranche and the second tranche. The tranche is a word that only came into my scope of awareness since ARPA, but it's used all the time now in certain circles. And what they wanted to focus on for the first 12.6 million was they wanted to focus on homelessness, on community violence, behavioral crisis, mental health, and workforce development. And so, and then in the course of that, as Janet mentioned, Columbia Housing Authority came to both the city and the county with an opportunity to leverage some state and federal funding for some renovation of facilities. And so council has sort of earmarked 2 million, I believe, for that. So what we've been doing is basically we have RFPs out. One of the things that council was interested in, Burrell Community Health Center, which is called Brightly now, I believe. They are wanting to expand on their behavioral crisis center model. They have opened a behavioral crisis center over by Stevens Lake Park. It's smaller than what they would ultimately like and what they believe the demand for our community and the region is. And so it is their hope to be able to build a new behavioral crisis center. So that was one of the things that council had expressed an interest in contributing to. There were a couple, not necessarily ARPA related proposals that went out for workforce development that they put some funding to, but we have an RFP out in that area. We also have we have an RFP out for homelessness and community violence prevention for this. But how we became involved, so council said that, okay, those are our priorities for the first tranche. But then Councilman Thomas at the time said that what he really would like for the second is to get community input on how the second half of the money should be spent. And he wanted the process to mirror what we do with our community health assessment and community health improvement plan. And so council wanted to do that. And of course, at the time we were like up to our eyes and still in COVID. So it took us a while. We said, well, we can do that as long as we have a little time to get that started. So what we did is we started a community engagement process, started out with surveying. We had actual surveys that we got that were validated, 4,470 that were analyzed. They were a very representative sample. So we analyzed the surveys. We also really sought to focus on groups that we felt were disproportionately impacted. So our BIPOC community, low-income households, to name some. And then we followed that up with focus groups. And we did 12 focus groups. Again, really trying to hear from people that we wouldn't normally hear from in the course of our daily work, or, you know, those that were the most engaged that would say what they wanted. And so we took all of that information, consolidated it, presented a report to council. And I don't think, at least for me, the key findings, they weren't anything that surprised me. Things that were important were mental health and access to healthcare, which was one of our community health improvement plan things in our 2018 community health improvement plan. Affordable housing and financial strain due to the pandemic, which also is part of our community health improvement plan. Workforce wages and retention. So we recognized, the community certainly recognized the impact on the workforce. And then a kind of a broader area, which was like access to services, supplies, and information. So, and I think that's the nod, as Janet and I mentioned earlier, that even though it seems like we have a lot of money, the demand is so great. So what we're doing now is we are continuing with the RFPs for that second half of that funding. Those are all out. We work closely with the finance department, city manager's office, our law department, to like try to make sure at every step of the way we are following the rules because we do not want to run afoul of the Treasury. So what we have a two-part process. Start out with a letter of intent. And so we take those through a program called Resource X. It's fairly simple. So we have the letters of intent out for the various things. Community violence, workforce development and support, homelessness and mental health, those closed on the 27th. And then access to services and affordable housing closes March 22nd. So February 27th, March 22nd. We have a process. We have kind of a two-part process. So we have an internal cross-department group that reviews the letter of intent to make sure that it does meet the ARPA criteria. We actually have the same kind of scoring tool for the inside and the exterior group, but we're looking for alignment with ARPA priorities and the city plan, strategic plan, demonstration of need, efficiency, like the program cost per individual or project goals. We're looking for an equity impact, outcome measurements, and then financial sustainability, because as Janet said, this money ends the end of December 2026. So can whatever we fund sustain itself, or we can fund something great it's just going to wither
And die.
on the vine. So anyway, we once we have all the, we've gone through the letters of intent, had the scoring, people are invited to move into a full proposal. They submit that through ARPA, which is how we do our social services proposals. It's how Boone County Community Services does their proposals for their programs, and also United Way. And then there will be an exterior group that the mayor has, I'm going to say appointed, but has, with the advice and consent of council, will be coming in. And we felt that was really important because there are people that have some expertise that have, that they're not city employees, right? They're people from the community. Some of them have extensive involvement in funding requests and know what's happening in the community and how funding, you know, like how program outcomes and measures and all of those things happen. So they will come back with their recommendations. We'll put everything in a report to council, and then they'll be making their decisions.
Okay, thank you. We do have some questions now.
And
First
Barb,
one-
would you
Yeah.
mind real quick if I just briefly tag
Oh,
on to what
sure.
Stephanie had said?
Go
Thank you.
ahead.
So just to sort of kind of close the circle, the survey results that that Stephanie's department was able to get, they very kindly made those survey results available to the county, because if you live in the city of Columbia, you also live in the county of Boone. So thank you, Stephanie, for that. We also put out a survey, and that compilation has also been made available to us as we're going forward. We're having listening sessions across the county. Actually, our last listening session is tonight, and that's over at the Empowerment. I think that's the name of it. It's Pastor Wood's church.
Urban empowerment.
Urban and Empowerment, yeah. So it'll be out there tonight. So that'll be the last listening session across the county. And we've done from Centralia to the bottom of Boone County. So all over Boone County. And we've done it a little bit differently than the city. We haven't divided it into buckets of issues. What we've said is we have a March 31st deadline for an application for the first, I'm going to use your word, Stephanie, tranche of money, right? And we're going to allocate up to $15 million in our first round of funding. And it's up to the applicants to say under what aspect of the legislation is their application being made. So they're having to say how it is an eligible expense under the ARPA legislation. We've referred them, as Lauren has pointed out to folks, given the link, there's the legislation is there, and we've said, how does this apply in the application form? How does this fit within the ARPA legislation? So again, March 31st for the first application deadline. Through the month of April, those will be evaluated by internal individuals to help us to make sure that indeed they meet some criteria or where they fall within the ARPA legislation. During the month of May, we too will be having a group of outside people that aren't Boone County employees to help look at this. And it's the same kind of group of people that are used to looking at these issues. And specifically, because this is a small community, a lot of people have fingers in a lot of different areas. And so if someone has made an application that they've made an application, or that they may have an interest in something, must be disclosed. And if they've made an application, they have to recuse on any consideration of that application. So we've created that process to where there's not going to be somebody voting on something where they have an interest in that specific project or that issue. At the end of May, then it'll come to the commission and probably we hope by the middle of June, we'll be able to make the awards out of that first tranche of money. And again, that's up to $15 million. It may be less, depending on what we get, the applications we get. But that will give us over the summertime, the opportunity to enter into contracts, to get that through the purchasing process, to get that through our county legal process, and be able to make those awards. In mid-September, we anticipate starting that process again. And with the money that remains, we'll again have that process of having a deadline, probably the end of September, for the next round of funding, with review, internal review, then external review, and then award, we hope, by the end of December. So that's how that will go. I'm sorry to have interrupted, Barbara.
Yeah. Oh, no, that's great. You sort of completed the circle there.
Yep.
And really gave us a good overview of the beginning process and the whole process. We do have questions, so I'll get to those.
Barbara, you are kind of choppy, so you mentioned you might turn off your video to see if that helps with your audio.
Okay, yeah, I'll do that. So let me see if I can get back to the chat there. Oops, here we go. Is that a little better? I hope.
Yes.
I have a question. It says, I don't understand how stormwater and wastewater are priorities for ARPA funding. Broadband absolutely makes sense. Water and sewer infrastructure does not make sense to me. So do you want to address that?
Sure. First of all, remember that we are doing in part, evaluating and reading the statute. This is and the rule, and this is the language that Congress, this language shows congressional intent as to how the funding can be allocated. That's what Congress said. They specifically looked at those issues and that those pieces of infrastructure that they believe are, and they allocated the funding to be able to be addressed. And, and when you start thinking about it, they're looking for things that have been impacted by COVID-19 as well. Wastewater, and Stephanie can talk about this all day long. Sewage is one of the is a public health nightmare. And that's one of the things that often is neglected in a community. And this gives communities the opportunity to fix issues, to close down lagoons, to get people on public sewer, which is a huge, huge public health issue. So,
and I would even add, Janet, that during COVID, at times when people were not going in and getting tested, it has been through wastewater sampling and testing, and the remarkable work done by Dr. Johnson at University of Missouri, that we had a clearer picture of what was happening in our community. So even though we know public health and wastewater go hand in hand, dating back hundreds of years, it was very important during COVID.
Yeah. So again, it's statutory interpretation, and here it's not even an interpretation. It is, we read the statute and it's specifically called out in terms of these are eligible expenses. And because I've learned from Stephanie and I've learned from my mom, a public health doc, wastewater is one of the keys, and potable water, again, is a key to a healthy community. So those two things, in my estimation, Congress hit the nail on the head with those two things. But again, we're not even talking interpretation. We're talking about just reading the statute.
Yeah.
Great, thank you. And along the same person said that she's very interested in the community violence prevention. And how can she see the RFP for that, or
I think Lauren put in the chat, most of the city's documents is housed in, the Be Heard Como site. And, we have two, people here that are sort of leading and coordinating amongst all the departments, and that's Carrie Utterback and Jordan Bales. And so I would encourage, their information is on Be Heard Como, and I would encourage you to reach out to them directly. They've been, and when they get, what they do is when they get questions in Be Heard Como, they try to make sure that those are out there so that your question can be viewed by others.
Thank you. Yeah, so thanks, Lauren, for putting that on the chat. I didn't see any other questions, but I had a question, an overall question. What controversy do you see about the use of funds, or what controversy is there at this point in time?
Well,
Yeah.
I would think, you know, I think that there, again, is so much need in our community. We are so blessed in this community, have such great resources in our health and social services, and our, I mean, more so than so many other communities in the state. But we also expect and want to have even more, right? We're a very caring community. And so I think that always there are going to be some people that receive funding, some that don't. People are going to question, well, why did this agency get something that another one didn't? And, you know, so I think those are in any funding process. I mean, I see it even in funding we apply for with the state. You know, when you find out Kansas City Health Department got a lot of money, you think, well, why'd they get all that money? So I think there's just always, I think there's always that. But I think the timing, you know, I think we know the need is so great, and we want to do things like people want things done yesterday. But, and I think I can even speak for the county on this. We've come through a pretty difficult time, and in fact, our resources are strapped just like everyone else's. And so I think moving along and trying to follow the rules and make sure we get it right doesn't mean we do it fast and we do a bad job at it. And, you know, the wheels of government are never as fast as we all would like them.
And I totally concur. You know, as we started off the conversation, 35 million sounds like a lot, but I think each one of us probably has gotten or knows of at least 10 million or 100 million that could be allocated and still have more need. You know, this is, I went to a NACO conference, a National Association of Counties conference, right before they passed the ARPA legislation. And Speaker Pelosi was there actually with another congressperson from the other side of the aisle. And what struck me was they both kept saying, this is to effect transformational change. And so, you know, there are, as you look at your community, there are so many ways that we could affect transformational change. And it's, you know, it's through some of the work that the health department has done to get those responses from the community, that to me, it's important that it resonates with what's already been done in terms of that community, that health evaluation. That's the last one was in 2018. They're going through the same process now to see what are the needs to address disparities, to address public health issues throughout the community. But the need is enormous. And as Stephanie said, you know, we want more for our community, and therefore we expect more. And wouldn't it be great if we had that 100 million? We don't. So we'll make as good a use of the funding as we can, and know that the need is still there.
Thank you. Actually, that addressed the question I was going to ask you. So, which was, do you think that you'll have enough applications to use the money, and we'll be turning down people that could use the money. And that's
Yeah.
exactly what you're saying.
Yeah.
I think that's all the questions that are in the chat. Thank you so much. I think this has really helped us get a good overview of the process and the careful approach, and why it takes a time. Oh, there's one more question here. Please explain what resource
Perspectives. Yeah.
resource X is.
Well, I'm probably not the best explainer on it. So Resource X is, for lack of a better word, it is I'm going to call it a company that is used. I might not even have the company name right, by a lot of municipalities and I guess potentially counties, but I know of it more in the municipal world. And they do a lot of budgeting systems and a lot of budget-based decision-making and different processes like that. It is pretty widely used in a lot of communities. One that I'm aware of just off the top of my head is Fort Collins. I know that is something I think that the city's been interested in for a long time, but Resource X, as a response to ARPA, they created, I'm going to call it a module, for lack of a better way, to set up processes where people could submit letters of intent, that information could be collected, consolidated, et cetera, into a more streamlined process for reviewing applications. And so that was what the city opted to use for the very beginning of the process for those letters of intent. And then Apricot, I saw in your question earlier, Apricot's something that we've been using for years. Again, also sort of a software platform, as lack of a better way to say that our funding partners, so United Way, Boone County Community Services, and then the Columbia, the Human Services Commission, via our social services and human services department, that they use for accepting applications, monitoring and tracking accountability for the funding that they do every single year in our community. So we're just using that platform. And again, for Apricot, that's the full application. But it also has a mechanism built in that you can track, because one of the things that we across the city, the departments that have been working on this, committed to doing was being accountable, and that when the funding goes out, we're going to have a way to report on how the funding was used and what the impact was in our community.
Thank you. And while we have you here, can you give us sort of an update on the COVID in the community and Boone County? And
Sure. Well, it's really hard if you followed anything at the federal level. You can see that reporting has gotten less and less. And in fact, I'm sure that there are many that followed Johns Hopkins and their public health school. They did the really good. I mean, Johns Hopkins created the source where we could follow on what was happening all across the world in terms of cases very early on. And I know it was followed by many of us. Even that is being disbanded as people move away from most people that are getting tested are testing at home, where there is no requirement to obviously report your results. We encourage it, but there's no mechanism built in. So we don't really know who's testing positive in that regard. So what we do know is that most people that are testing positive, it's because they are feeling sick enough that they've gone to an urgent care, they've gone to the ER. So those numbers are down. I don't think we have a true count. We do continue to watch the wastewater samples on a weekly basis. And those numbers they've been a little bit on the increase over the last few weeks, with some of the newer variants that have been seen elsewhere in the country becoming more predominant in Missouri. So it's still here for sure, but we're not seeing the the hospitalizations, the things that cause such community impact just on our health systems and stress. So I think it's really important to note that if you haven't gotten your booster, it's time to get a new booster. I would still encourage it because it is definitely something to think about. And, you know, more and more information is coming out about long COVID. And we're learning more about that. And, you know, being vaccinated is our best protection. So,
Thank you.
Yeah.
I thought I'd go to the source and get the latest. I thought people would be interested in that. So thank you so much, Stephanie Browning and Janet Thompson, for joining us and sharing this information in a really nice fireside chat without the fireside.
Janet's got her
and I
heater on.
Yeah. You could join me.
Yeah. And I wanted to remind the viewers that our next Lunch and Learn program is April 11th, the second Tuesday of the month. And it will focus on agriculture, and Wyatt Thompson will be our speaker. And he's the professor of agriculture and applied economics at MU. And he also is part of the Food and Agriculture Research Policy Institute and does all the ag baseline work for Congress. So we're gonna switch gears a little bit for next week or next month. So thank you, viewers, and again, encourage people who haven't watched, your friends and your neighbors, to go online and watch this if they're interested, and I think many are interested. So thank you so much.
Thank you, Barb.
Thank you. Great
Thanks,
seeing you.
Stephanie. Thank you,
Bye,
Lauren.
Janet.
Bye.
Lauren.
Everyone.